Welcome to our final Board of Health meeting for Fargo Cass Public Health for the year of 2022. The first thing we will do is start with approval of the minutes from our last meeting, which were attached to the agenda invite, meeting invite. I would entertain a motion.
I move to approve.
Thank you. And can I get a second?
I second. It's Kayla Nelson.
Thank you. All in favor, say aye.
Aye.
Any opposed, same sign. Okay, previous meeting minutes have been approved. And then I will turn it over to maybe Desi or Dr. Newman for Board of Health member update.
Yeah, I just wanted to take a minute today and sorry for the last minute change of plans for virtual. We had lots of suggestions for virtual, lots of people having difficulty getting into their places or getting out of their homes type thing. So for me, I just wanted to say thank you so much for those of you who have served on the Board of Health with us, for those who have supported everything that we have done. And it's been a good year for us, you know, lots of challenges and different things, but there's so many opportunities that we have to be able to impact the health of the community going forward. So we're excited about that. This will be the final meeting of this group, and then we will go into 2023 and have a different, maybe similar, but different looking Board of Health. So just wanted to say to all of you, thanks for your time in doing this. I know it's all a volunteer effort, and we really, really appreciate having you.
Thank you for that, Debbie.
Sorry, I lost connection there.
Yep, I'm handing it back to Chelsea.
Well, be prepared, Lynn, because it could happen again, right? All right, excellent. Thanks, Desi. And certainly I've appreciated being able to serve in this capacity, and a lot has changed over the years that I've been on the board, and, you know, being virtual today is something that we had to get used to for a period of time. So I appreciate everything that you've done to make it easy to be a Board of Health member as well. So thank you. All right. I think next up we have a demo from Scott. I believe.
Yeah, and I will go ahead and do just a little bit of an intro. So I was looking through a NACCHO newsletter one day and came across a webinar that I saw that looked really interesting. So I watched it, and it was called Credible Mind, and it was a population mental health program for a potential for our area. So it really, really intrigued me. And so I contacted Scott, who is with us today virtually. Scott is the Senior Director of Business Development. So he works with state and county health departments and healthcare organizations and helps them on strategies to support the mental health needs of their community and their targeted population. So I'm going to just let him walk through this program with us, and then we can have any discussions and questions when he's done.
Thanks, Desi. Can you hear me?
We can.
Great. So my name is Scott Dahl. I'm with Credible Mind. For the past 7 years, we've been working in public health, population health, and we kept seeing mental health get worse and worse in every place we were working. So we went off and we did a lot of research to figure out what do we need to be doing differently, how can we tackle this issue. And so we came up with Credible Mind, and that's what I'm going to show you today. We're going to show some slides because of the going virtual, and I think they're going to advance the slides for me. But what we're going to talk about is supporting and strengthening, mobilizing community mental health. And what that means is It's for individuals to go in and use, definitely, but it's also for other people to go in. We have police using it in the field, in the streets. We have social health care workers, community health workers. It's also families helping other people with it. So it becomes a community of action. It becomes a culture of mental health by everybody using this, because mental health is affecting everyone. If it's not affecting you directly, it's affecting somebody you know, somebody you work with, and all that. So that's what we're doing. On the next slide, we think of the iceberg theory about, we're focused on what we can see of the iceberg. And so at the tip, we see people who are struggling and they're looking for care. There's a lot of people out there looking for that right now, especially after COVID and then the ongoing crises that we've been facing. It's just affecting everybody. So we care about those people too. We want to help them find care. Most of them are waiting 6+ months to see somebody. So they need something to help them in the meantime, and they do need help finding the care they need. We're also, though, worried about the people below the tip of the iceberg that have unmet needs. They are at risk. They have been undiagnosed, untreated. They have issues. They are waiting to see a provider. They are waiting more than 10 years from the time they first have symptoms to get any kind of treatment. They don't have insurance. They have insurance, but 60% of psychiatrists do not accept it. There's just a huge problem there, and it's something we need to fix. So we're worried about that part of the iceberg too. There's a lot of people at risk, and they're going to become a part of the iceberg too if we don't start dealing with it now. So we're trying to get the whole iceberg. That's what we're focused on. Most things right now with our reactive system are focused on the top part of the iceberg, or the whole iceberg. Next slide. Because we're public health people, we take a public health approach to this, and we think we can prevent a lot of mental illness. So much is focused on, there's an upstream and a downstream model here, and so much of it's focused downstream is trying to get people out of the river. We want to help there too, but we're going upstream, and we think we can stop people from jumping in the river in the first place. So that's it. I don't know if you know public health, but John Snow with cholera, he said, instead of treating more people with cholera, let's figure out the source of the cholera, and he turned off the water spigot. And so that's what we're trying to do with mental health, just as we did with diabetes. We know we can prevent a lot of it, and that's what we're trying to do with this. Next slide. We also know with mental health, it's cumulative. And so people usually don't just have one risk factor, they have a whole bunch, and they need to deal with all of them. And when we did our research, we asked people what issues they had, and we heard 3 and 4 things from each person. They were never just telling us one thing that they're dealing with, and they were all different. Mental health is very complex. One person's going through a divorce, and they just lost someone through COVID, and they lost their house, and they're losing their job and all that. So they need to deal with all their factors that can lead to mental illness. We also know that mental illness is not binary. We don't either have mental illness or we don't. We're all on a spectrum. We're moving up and down on the spectrum continuously, and we need to deal with all of our issues. We want to be in the upper right-hand quadrant where people are thriving. That's about 17% of adults, and that was before COVID. So I don't know if there is anybody up there in that part of the graph right now, but we all want to try to get up there, and we're trying to move up there, and we can do things about it. So on the next slide, we also know that there's ups and downs of life. So suddenly something happens, you get a new diagnosis, you lose your job or whatever, and you can move down as that one person did and become even worse with your situation. But the other 2 people are starting to do things in their life. They're starting to exercise, they're doing positive psychology, peer support, things like that, and they can move up the quadrant as they need to, or hopefully want to, or whatever, and then get into the thriving category. And that's what we're trying to do with the platform, is help people move in that direction. All right, next slide. Sorry, it's building a little bit.
I'm sorry, real quick, could we remind everybody that if you could mute your microphones, just there's a little echo that's coming through, and I think if everybody can check that, we want it to be the purple slash through it. So thank you.
Okay, if you keep going. Sorry, I didn't. So what we provide are two things. First of all, we have a digital platform, and this is not a shared platform that people go to. It is your own platform locally that will be branded with your site and all that, and it's your own site locally. And we'll look at that, and then we're going to talk about the services that we provide. So next slide is the platform. And so with it, it becomes your platform locally. You brand it. You put on your URL, and you can add in whatever you want to into it, any local resources, services, anything like that can go into the platform. And it's available to everybody 24/7, 365. It is web and mobile-based, and so people can have it in their hands when they need it. To use the platform on the next slide is pretty easy. All you do is you type in what you're looking for, or you can search across our topics. As I told you before, mental illness is complex, and we cover more than 240 different topics. So you can search on, the things we talked about before, depression and bullying and abuse as a child and whatever's going on with you. You can also look for mental health conditions if you're looking for anxiety, depression, all of that. On the next slide, I talk about some of our topics that we cover. That's not even half of our topics, but you can just get an idea of how complex our platform is, and that is because we know that people need these. We know across our platforms that people are selecting on every single one of our 240 topics. Some of them may be lower numbers, but that person needs that, and so that's why we're complex, and that's how we can help people deal with the net of factors that they have. On the next slide. If you don't know what's going on with you, and this is where we encourage most people to start, we have 18 assessments. And that way you can see where you are today. You can take this as often as you want to. You can share it with your doctor. You can share it with, other family members, whoever you want to share it with, you can. Or you can just save it there and see how you're progressing over time. A lot of those assessments are specific to something like sleep or substance use or your resilience network or support network. And then some of them are overall profiles, and I think those are some of the most important ones in here. So the second one, for example, is a profile. Click on that one on the next slide. It is all based upon validated scales, and you just go through and you click answers. The scales are actually over there to the right, and then there's a whole bunch of scales in this one because this is measuring 26 different dimensions of a human being. And so you'll get a lot of information about yourself. After you take it, you're going to get results. Like on the next slide, it's going to tell you areas you're doing well in, areas of some concern, and then areas of greatest concern. The areas of the greater concern are the things you really need to work on once you do this, and you can understand, again, so much more about yourself and what problems you have. So when I look at this one that I clicked on, you can see that sleep and worrying, which is anxiety basically, loss of a loved one, things like that are things that I need to deal with. When you scroll down on that page, you're actually going to get a score for every single thing in here. So you will be able to see like what your resilience levels are. Can you go to the next slide? What your resilience levels are. It'll triage you and tell you you're in the low range, the normal range, or the high range. And then, again, that will be saved on here so you can see how you're progressing over time. On the next slide is anxiety. And with this one, it actually is going to triage me because of my high score. You'll see I have an 83 out of 100. And it's telling me I need to seek professional help or the in crisis page or to talk to my doctor. And with the professional help, that's where we're going to connect people to the local providers and resources that you guys have in Fargo. And if you don't have any, we can connect to national sources or whatever. But those people need to seek help. The people in the low to moderate range, they just want, they probably want self-care and self-management, and we're going to help them do that too. But the people in that high range, they probably need to seek help if they choose to. So that's how we're triaging people. If I choose not to do that, I can go down below and I can start looking for evidence-based approaches of how to deal with it. And then it is going to recommend some interventions for me to use based upon my score, and those are down below. The other thing on the next slide that I can do here is I can look across different scores that I have and see how to deal with this. And this is actually going to get to the root cause. And I'll just tell you a story about a college student who used our platform. He actually, these are actually his scores, and he had an 83 for anxiety. And then he saw below he had a very poor sleep score. And he went to his parents and he said, could sleep have something to do with my anxiety? He had been treated for the past 5 years, was on meds, was getting therapy. And they said, yeah, but what are you talking about? Why would sleep have anything? What are you talking about with sleep? And he said, I only sleep 1 to 2 hours a night. And they said, well, is that since you got your anxiety? He goes, no, that was first. I haven't ever slept very well. And I'm just realizing it, I guess, with the score. And he realized that was the root cause of his anxiety. So he went off and he worked on his sleep, and he just went down that pathway, and he dealt with the root cause of his anxiety. And so he's off his meds now. He graduated from college. He just got his first job. So everything's, going really well for him. And that's what the platform will allow you to do, is look for root causes if you can find them instead of just dealing with the issue. Now, on the next slide, let's just say I want to work with the issue. So I'll click on anxiety. I'll go to a page, and I can learn all about anxiety. I can learn what is it, what are the signs and symptoms of it, so I can see, does this apply to me? On the next slide, I can see what types of anxiety disorder. That becomes really important, because if I have social anxiety, generalized anxiety disorder, I can work on the one that's appropriate for me. On the next page, scrolling down a little bit further, I can see how common is it. This will help break down the stigma. And I'll see that I'm not alone. I'm not the only one with anxiety. There's a lot of millions of people that have it. And so this isn't unusual. I don't need to feel like I have to hide it from everybody. You also see how this happened. And then on the next slide, it actually gets into, again, the evidence-based approaches. And this is our own proprietary schema where we came up with this, but it is all based upon clinical studies that were done all around the world. And so if there's a lot of studies that were done, it's going to be in the highest category. If they were just done in LA and New York and whatever, but they're good-sized studies and all that, that'll probably be the middle category. And then the bottom one are going to be emerging approaches. And in there, in that second category, you'll actually see sleep, and that's where he found sleep. The other thing that he does now is he found creative expression. And he said he wanted to learn to play the guitar. When he's going through a stressful situation, he will walk away from it, play the guitar for 15 minutes, and then come back and deal with the situation. And that actually can reduce your anxiety by 28%. So that's how he chose to deal with it. And again, he's off his meds and all that. So that's how you use that part. Next slide. Once you get into it, we have over 15,000 interventions in our platform, and we have carefully curated what goes into our platform. So, for example, there are 20,000 mental health apps out in the world today. We have about 900 in our platform. That is how carefully we curated what goes in there. Most of them are universal, and they're going to work for anybody, but you can also target the interventions that you're looking for. So you can look by your demographics, your identity, how you like to learn, and so forth. So maybe you're African American, or you're male or female, or you're Hispanic, or you're LGBT, or you're a vet, or you like to learn by listening and you want podcasts, or you want to read books, or whatever. You can choose that way and find targeted things for you that'll help you with your situation if you choose to. And again, the universal will work for everybody, but you can find targeted interventions. So on the next slide, if I targeted looking for college students, I can find interventions that were created just for college students. Maybe I'm a parent and I want to help a child, so I found things where I could help a child with anxiety and so forth. So it's going to filter down things and help you find things for whoever you are, however you like to learn, whatever you want, based upon who you are. And then also on the next slide, how I like to learn. So maybe I want peer support. Maybe I want guided activities. I want online support programs or whatever. So I can choose different things based upon, again, what I'm looking for within the platform. Next slide. And then once I find an intervention, I click on it. One thing you'll notice with our interventions, every single one of our interventions, except for original content that we put in, now have scores on it. So you can see this one that I clicked on as a podcast has a score of 4.5. So now it gives it some evidence. It shows, you know what, our clinical team actually reviewed all of these and, you know, what they think of the intervention. I can read more about it down below, and then I actually can listen to the podcast within our platform. So I can just start taking action immediately. If after I read it, that's not the right thing for me, I'll go back and then I can click on a whole bunch of other things or whatever that's going to be appropriate for me. The other thing I'll point out here is across the top, you'll also notice there's other buttons for Need Help Now, and that is in crisis. Those are national hotlines and chat lines, but you can also put in local ones that you want. We also have a COVID section, and if you choose to, we plan on keeping that within our platforms for about 3 to 7 years. We know the effects of COVID, the isolation, the loss of loved ones, and all that are going to linger for a long time. And we know that based upon MARS and SARS and all that. And so it's going to, you know, it's just going to keep lingering on, unfortunately. And so we plan on keeping those in there. And that's very different. So like it's about anxiety during a pandemic, not just anxiety. And that has very different tools and information than it does if you just look up anxiety. And that's just one example. So that's in there. There also are news and blogs. And those are based on our 242 topics and just constantly changing. So anything that comes out in the news that's based on any of those topics, that's going to be updated in your platform. And our blogs are written by our clinical team. And so they also write about the 242 topics. So that's how comprehensive the platform is. That's the reason people come back and use it constantly. Next slide. Partners can also have widgets. And so it's just a little tool that we give them that they can put in their websites. It looks like you're starting to use our platform, but then what it's going to do is after you click on it, you're actually going to go off to our platform. So it drives a lot of traffic. So we encourage universities to put that on there, businesses, you know, all schools, anybody that you want within the community to actually have that widget, because again, it's going to drive traffic. Because our platform is about health, your mental health, promote prevention and early intervention, we think it's appropriate for everybody to be using. So we want very high usage of it, and the widgets help do that, driving traffic to the platform. All right, the second part of what I told you about that we offer are professional services, and we do have masters of public health, even doctors of public health that actually provide this. And part of that is data. So we saw scores on the assessments for me, for my anxiety or for sleep or whatever, but you're also going to get real-time data about your population. So all those numbers are aggregated together. You will never see the individual score, but you can see what's going on with your population. So what is the anxiety level right now? What is the depression level, resilience level, all of that? And there's about 31 pages of data in there. So it's very, very powerful. Again, it's real time. You will see the effects of if, you know, God forbid, there's a mass shooting in your community, if there's a major layoff or whatever, you're going to see the effects of what's going on. And you'll be able to track that real time. You'll be able to go back and see how things have changed from maybe a year ago and all that. So the data is very, very powerful. The second thing that we do is we do an analytic report, and this comes out quarterly. This is on the next page. And this is from our Masters of Public Health, and they actually pull this together. It gives you benchmarks to other organizations, so you can see if your anxiety level is at a certain level, is that good or bad compared to other places. And so, again, this is coming out quarterly. It's going to tell you what people are clicking on, how long did they stay there, did they download an intervention, did they go down evidence-based pathways and all that. So, again, a lot of really good information that you're going to get back about the users of your platform and about the members of your community.
On the next slide, we do want very high usage. So we give you a lot of engagement tools that are branded for you. So there's posters that can be used by everybody. On the next slide, there's a lot of social media. There's newsletters and all that can be sent out to partners, but also can be used to drive traffic to your platform. And these are just continuous. If it's Depression Month, and that's, we can push out depression things. If it's Heart Month, there is a link between heart disease and mental health, and we push out things like that. So there's a lot of tools that we will continuously push out to you, and that can be pushed out to your population to drive the engagement. And just the last part I'll talk about is the platform is automated, so it is housed on our servers. We keep it up to date. We're always updating it. It'll change constantly throughout a day. If there's a brand new intervention for depression that came out today, we know about it. It does not automatically go into platforms. It goes to our clinical team to look at to see if it's appropriate to add in. But we're adding in new blogs, the news and all that all the time, even new topics. If, we heard about wildfires a couple of years ago, we heard about election stress, and so we added in new topics for those. So we keep it up to date. It's housed, it's protected, security's in there and all that. It's on our servers. We keep it up to date, although you do have back-end administration. So if you want to load in a brand new local resource or something like that, you can do that, or you can give it to your account manager and they will load it in for you. All right, last thing I'll talk about are outcomes. And so what we're seeing across our platforms are 90% of people are giving it a thumbs up, helpful, and they said they would refer it. 71% say they better understand their mental health strengths and challenges. And I think the rest of the people either did not take an assessment, so they were just looking for one thing, and they don't have a really good picture of themselves, or maybe they were diagnosed and they already have, they already had a good understanding of where they were today. But I think it's really powerful that most people now have that understanding of themselves that they didn't have before. 70% of people feel better about themselves. 61% of people said they learned a new skill or practice. And then 57% of people actually changed behavior because of our platform. Behavior change is really hard. I've been doing work like this for a long time. If we could get 2% of doctors to make a change in their practice or behavior, that was like a miracle. So to get almost 60% of people positively changing their life with our platform, that's really powerful to us. The deal with our platform, though, it is your local platform, and everybody's using it the way they need to or want to. It could be based upon the data that we give you. It could be strategy that you have and all that. So all of our clients are using it different ways. We're working with a major healthcare system out of Seattle, and they're working on their own staff, their doctors and their nurses, trying to reduce burnout, compassion fatigue, and all that. So their outcomes are based on that. But this is an example from basically the Boston area, and we started working with the police. They said they wanted to divert people from jail or for the emergency room that had mental health issues. They said most of these people did not need to be going to those two places, and so they wanted to divert them, and so they actually take our platform out into the streets on tablets, and they work with people on the streets. They take assessments, they point them to intervention. And so they have saved more than $8 million by diverting people away from the jail, criminal custody, and away from the emergency department. And that's how they're using it. Actually, brand new numbers are coming out this week. And they were expecting to be about $12 million worth of savings or whatever. The White House loves what they've done, and they actually have reached out to them, and they're looking at maybe copying the model across the country, whatever. So there's a lot of interest in what they've done. But we have stories like this all across the country, and it's just that everybody has their own outcomes based upon their strategies and their needs. So that is sort of mine. I'm sorry I didn't get to show you a live site. We just knew with the change of everything today, we couldn't do that, but I can send you a live site if you actually want to go in and play with it. But basically, you saw it in the slides. We just took slide shots of different pages. But I'm going to turn it over to you guys for questions or comments.
Thank you, Scott. Questions for Scott?
So I'll just comment as to why I think this is kind of a really interesting thing. You know, we've kind of struggled with public health and, you know, what role is mental health in public health. And so this is one of those areas that really defines the prevention, the education piece that really is population health. So I think that's why it's so intriguing to me. I also, as the mother of a 20-some-year-old who doesn't like to call anyone and ask for assistance or do those things, I know we have a large population that is averse to making phone calls or reaching out for help sometimes. So this would be a platform that people could access and kind of start that journey a little bit on their own and hopefully get into some avenues for help. So those are kind of the things that are intriguing for me is that you can just, you know, load all of our local resources and yet have all of this wealth of resources within the program that have all been vetted and that are credible, you know, evidence-based, you know, programs, practices, that type of thing. That's kind of what intrigues me the most, I think.
And you're right about that comment. Actually, 75% of people prefer to start working on mental health on their own. And that's because stigma is still out there, discrimination is still out there, and insurance problems. I told you before, 60% of psychiatrists do not accept any insurance at all. So even if you have insurance, you may not be able to afford it. 25% of people said the copay is so high if they do go into someone. They're choosing between either necessities for their family or paying the copay, so they're going the necessities for their family. So there's just so many people not accessing care. So where somebody else wrote about this, and I think it's a perfect description, they said, we're kind of filling the blank page of what's, you know, right now there's a blank page of nothing out there to tell people, and we're trying to fill that in.
I just want to chime in and say how great that was. I feel like, how has this not been a thing for years? I just think of like how many patients I could have referred to this for resources over the years, and super exciting to see.
Thank you. Yeah, I think what we found with our research is people think that they have something out there, and they may put out Calm or something like that, and they'll help people with breathing or with meditation or whatever, and they think that's the solution. But not everybody needs that. I mean, we have that in our platform if somebody needs that, but let the people choose that need it, and let other people find the things they need. It's actually kind of amazing talking. We work with the state health department, and the director there loves our awe section. And I said, why do you love? And she said, awe. And I said, awe? I didn't even know we had it, honestly. And she said, yeah. She said, it's just absolutely amazing to like appreciate the world, but also the wonder and kind of the fear of the world and all that. She said, it just really makes you humble. And so everybody I talk to uses it differently. And that's what this is supposed to be. It's, you know, really, it becomes individualized to you.
And so just so you guys all know too, so this is obviously a paid program. And so I am trying to look at some potential grant funding to do maybe like a 1 to 2 year pilot of this to see how things go. So Scott, I believe you said it's $17,000 a year for a license. Is that correct?
That's correct. Yep.
And then a $1,000 setup fee, I think.
Right. A one-time setup fee, right?
Yep. So I guess what I wanted to do was just come before the board and just make sure that, you know, you guys all felt the value of this as I do. And so just kind of, you know, looking for that feedback to see if you think this would be worthwhile for us to try in our community.
This is Lynn, and I think that this is fantastic. As I was watching it, and then I have the website pulled up here, I thought, you know, so often there's so many, like I think he said 20,000 apps that exist out there. So if a person is struggling and they go to look something up, you don't know what you're getting. Is this evidence-based? Is this, you know, reliable information? And so I love that I really love the usability of it and how it really can take you from any direction. I love the filters. So one of my questions was, I really appreciate the reduction in ER visits. As a former ER nurse, I really like to see that reduction in ER visits, because we know so many patients who end up in the ER really don't end up getting what they really need at the time anyway. However, knowing that we are still struggling with like outpatient type access for mental health in the community, do you see an increase in the need for, patients requesting appointments for therapists or getting with their primary doctor? So if we reduce the ER side, is that because they're getting what they need from the website, or I just want to make sure that we address the capacity issues or the access issues that we already have.
Absolutely. So what we're trying to do is triage people and to get the high-risk people into the care, because those are the people that need to be going there. The people with low to moderate risk do not, and we're trying to get them to self-care. And also what is happening is we have a lot of customers who are actually behavioral health centers or hospitals, and they are actually using this as like adjunctive therapy for someone coming in, because unfortunately, probably out of a year, you're seeing a therapist for a couple hours, out of the whole year. You need to be working on this on your own. This is, I think I actually compare this a lot to diabetes. I mean, self-care is so important with diabetes, that you're eating right, exercising, managing your stress, taking your insulin and all that. And so even for somebody that is in the high risk range, we are just seeing that they have so much better outcomes because they're working constantly on their issue, not just, the 1 hour a month or whatever that they're getting in to see a therapist. So it's helping with that too. So, but I think the main answer is we are diverting people from the emergency room, but we're getting tools to people so that they can work on it if they need to. But then the ones that need to be going to the emergency room or to doctors, we're getting there. So we're trying to get the right people to the right places.
I appreciate that. The triage part of it is important. And I will be sharing, I work at a health system in town, and I'll be sharing this with them as well, just from a health system perspective as well, because to your point, we can get the high-risk people into the ERs and into their providers and try to manage some of these patients with self-care instead. So I think this is fantastic, and I appreciate the demonstration.
Absolutely. Once you get in there too, there's a lot in there for the provider themselves. And as I said before, it's actually Providence that's one of our hospitals that's working with us. They're using it for their own doctors and staff, because they were frontline workers. They went through burnout. They're going through compassion fatigue, huge turnover right now in staff. So use it with them too, because it is a huge issue among that staff.
Thank you, Scott. I was just going to ask a quick question. Maybe I missed it in your presentation. Is there specific services targeted to youth or adolescents, or is this meant for adults only?
It's for both. We actually have hundreds of resources that are for kids, for teens, and then for college students and all that, so anybody can use it. We do encourage, for the younger kids, we encourage them to work with a teacher or parent or someone else to navigate it. I mean, the tools were actually created for kids. I think there's 570-something interventions just for kids to be using. But to get there, you have to make, they may not know what anxiety is to click on and all that. So to work with somebody else, a parent, and helping them find the things. But our platforms for everybody, and we want everybody using it. But, again, some people may need help navigating. And that actually could be adults too. I have a friend who's going through major depression, and I figured out it's caused by just feeling like everybody else has a Mercedes or a Roadster or whatever, and they don't have one. And they're just looking at all the things they don't have. And I'm like, look at how many people that didn't sleep in a bed last night, or that don't have a car at all, or don't have a meal this morning or whatever. And I said, you need to practice gratitude. And one of my favorite parts of the platform is positive psychology. So it's pointing other people to things too. And so I have my friend working on all of that right now, and it's really helping. So, it's all about, again, all of us working together on it.
I just wanted to say, as a psychiatric provider, I think this is amazing, because I'm always telling people you need to make sure that you're working on your mental health outside of the clinic, outside of this office. So the fact that you have compiled all of these different resources together, that's phenomenal, and not great, or not just for my clients or the people who are coming to see therapists. But then they can share this site with other people too. If I know my friend is struggling, like you said, if you know your friend is struggling, you can share it as well. So you can really help on that population level. Yeah, that's fantastic. I love this.
Thank you.
So Desi, has there been any conversations in terms of the state engaging on a platform such as this? Or is it left up to county by county?
Yeah, I did do a pitch to the state to see if there might be DHS funding for that, and didn't really hear back from that. But I do think I've talked to the health equity coordinator at the state level, and would qualify for their funding, especially when it has the COVID resources and that angle included in it as well. So I believe I have a funding source to cover it. And so if we would consider it, we probably would just do it for Cass County at this time, just to see how it goes. But I certainly feel like we could then share our results with others and see if we might get some more people on board.
It's very scalable. It doesn't have to be at a county level, but it is very scalable. So like if you start with Cass County and then you want to do your MSA, even getting Minnesota involved or whatever, you can do that. So you can keep expanding it as you need to. What I think you're going to find with the platform is it kind of becomes organic. Partners are going to come on because they want to be a part of it, and they'll see, they're tied to it. And that's going to happen. But it can become a state site. It can become a Northwest side or whatever you want it to be. So we don't have any, you decide what the population is, and we make it available to that population.
All right. Looking at the time, I think I appreciate the discussion, and thanks, Scott, for presenting. It certainly is a good resource. Desi, just from somebody that works at an insurance company, we do have some other partners that do similar types of things. So just for perspective, I'll share some of the other platforms that I've heard of as well. But great work, and certainly something that's needed and recognized. Not everybody has health insurance, and so we need options that serve the community at large too. So thank you, Scott.
Okay, thank you.
All right. I think next up is Melissa to give us an update on what she's been up to.
Yeah. Hi, everybody. Sorry we aren't able to meet in person. I do have a presentation. There it is. Yay. So as the mental health coordinator, I took over that role last November-ish. And then soon after we were working from home. And so I had to come up with, how is this mental health role, this brand new mental health coordinator role going to look here at Fargo-Cass Public Health? And so I decided that we needed to come up with a tagline or something that I really, would focus all my work on or under. And so I came up with the tagline of "No feeling is final." So if you want to go to that next slide. So "No feeling is final." Came up with that, came up with 3 basic goals for mental health work at Fargo-Cass Public Health. So inspire community-wide change through education, work to increase understanding and reduce stigma, and then partner with community agencies to increase positive emotional well-being in our community. Next slide. I'm going to fly kind of through this. So if you guys have questions at the end, so we have time for questions at the end. So areas of focus became our creating a website, because obviously this is a brand new position. So we didn't have a website yet. So we created a website, outreach. How are we going to do outreach? Social media, early childhood, community partnerships, and then adolescents and adults. Next slide. So these are links to our webpage. So we have that short URL, fargocasspublichealth.com /mental health. So it takes you right to our mental health website. And then we did create a PSA. I can show that to you later if IT has that available, if we could pull that. But I'm not sure what happened. But within our partnerships, so this is a public service announcement that we created with Fargo PD and the 463 Foundation. We've partnered with them a great deal to bring you different educational opportunities. Am I the only one who can't hear that? Okay, Desi's shaking her head.
Yeah, we're still not getting any audio, Brian.
It's all right, Brian. Everybody can go onto our website and look at it at some point. It also, last week, I found out that Fargo Public Schools put it on their co-curricular website main page. So that was fantastic news as well. So I'm just going to keep on moving past the PSA. I am extremely proud of the PSA because it was just something that we worked really hard on to make sure that we had the right information, the right messaging for that. What the PSA does is it encourages people to create a safety plan. And we know that a lot of times what's happening is with suicidal ideation, we know that people think about suicide for sometimes very short periods of time. And so if you have a safety plan in place, if you train your brain to know what you're going to do in case you start feeling that way, in case you find yourself in a moment of crisis, you're able to respond to that appropriately. And so that's what the safety plan PSA is all about, encouraging parents to create a safety plan for themselves, and then also to sit down with their kids and talk about what their safety plan is going to be. Next slide. So then I mentioned, did we miss something? That's okay, we'll go to early childhood. So early childhood education, I decided we needed to do some no feeling is final stuff there too. And that really stemmed from my kids. I have twin 6-year-old boys, and we were struggling with one of them as far as just managing his emotions. And I was like, this falls under no feeling is final. And so I started looking into different trainings that we could do. We found Tucker Turtle. And so we came up with the Managing Big Feelings with Tucker Turtle training, and we have been providing that to childcare employees throughout the year. When childcare employees when they come to our training, we are able to provide attendees with a book and a turtle puppet. And we were able to print those books on waterproof, tearproof paper. So if we were in person, I'd be able to pass this around and, tempt you to try and rip it. You can't rip them, and they're wonderful books. And then we also have the Tucker Turtle puppet that goes along with the book, and how childcare workers can read that book to the kids that they are taking care of, and really start talking about emotions and how emotions are okay. And we all have emotions, but we all have to be able to learn how to manage those emotions. We also partner with AFSP, or American Foundation for Suicide Prevention, to distribute the Gizmo Possum Guide to Mental Health books. So they provide us with these books, and then we in turn take them and we provide them to our partners out in the community. So those have been very good as well. And then we also incorporated Baby Faces and My First Book of Feelings books into our nurse family partnership programming, which has been fantastic. Our nurses are really excited to be able to give these books to moms who sometimes, they might have flat affect. They might come from backgrounds where they were never taught about feelings. They didn't know. They don't know how to teach their children how to manage their feelings. And so that's just another way that we reach our community. And I think it's really just a fun way for our divisions to be able to work together, because mental health needs to go into all parts of Fargo Cass Public Health. Next slide. Okay, so we have done some events We did a Night of Hope, which was another partnership with 463 Foundation and the Fargo PD. Changing the narrative trainings, those are going to be brand new in 2023. I'm a trained trainer of that. We did Out of the Darkness Walk. That's just a list of the different partners that I have come into contact with and worked with over this last year. Next slide. Adolescents and Adults. So we brought in Nathan Harmon. He is he's a nationwide speaker. And we did a Night of Hope. We did a Night of Hope twice at Bethel Church. We were in all of the high schools, or the majority of the high schools, I should say, a couple middle schools. We created posters, No Feeling is Final posters, which we have just recently revamped to include the 988 number. And then we were able to get these posters. These are also on that waterproof, tearproof paper. And we were able to get these on all of the MAT buses, which is wonderful. And then the 988 QR code. So then if someone is on the bus or maybe this is in the bathroom somewhere out in the community, and they are struggling, or they think, I might need that at some point, so they can use that QR code too, just to have that in their phone. So we have those as well. We also created No Feeling is Final stickers for water bottles and magnets, and those have been very, very popular among young kids. So we have No Feeling is Final stickers and magnets. We have there's therapists in the community who use those on a regular basis for their clients to take. Southeast Human Service Center uses them all the time. It's been that No Feeling is Final has really been a wonderful tagline for us here at Public Health. Next slide. And then our FargoCast Public Health team, we put our No Feeling is Final white logo on T-shirts for Suicide Prevention Month. And so we had those T-shirts and we wore them every Friday in September. We have done an employee book club. We did a lot in regard to last May. May is Mental Health Month. And so then we had the mayoral proclamation in May. We created a green No Feeling is Final logo, and we had that as our, it was the first ever, I understood, the first ever frame for a Facebook profile picture. So if you still want to use it, you can. It's out there. You just have to search frames for, I think it's just No Feeling is Final, and it'll pop up for you in Facebook. But that was also a fun thing that we've never done anything like that here at Public Health. So that was a neat experience to be a part of as well. Next slide. That might be it. Yes, this was just a billboard or board at actually Fargo South that I ran into earlier this year, and I just thought it was fun and just a nice way to end this. Does anybody have any questions for me at all? I wanted to go fast to get through this so that we had some time for questions if you had any.
This is Lynn, and I think this is fantastic. I just found the frame and added it to my Facebook because, I think that this week with the news of Twitch, death by suicide, I think it's just, now everyone's talking about it again. So how do we continue to share that message? And we look at people like someone who seems so happy and energetic, right? So I appreciate this work and appreciate the ability to share it on my social media page to encourage people to reach out for help. Knowing that gun deaths are, statistically in North Dakota, guns are a significant form of use, or it's most commonly what people in North Dakota use for suicide. And Desi and I have talked briefly in the past about this, but I would just like to encourage and recommend maybe a presentation at another meeting about gun safety, safe storage. There's a lot of different programs out there. I just attended the Institute for Healthcare Improvement conference in Orlando last week, and there was a keynote session on gun violence prevention as a healthcare crisis. I think public health fits in there too. So I just want to encourage us to consider those conversations about gun safety and safe storage, and then advocating for the extreme risk protection orders in North Dakota. We don't have those right now that would help keep guns out of the hands of people in crisis. So thank you for that presentation. It was fantastic.
Yes, thank you, Melissa. Tons of work going on in your area. You've done a fantastic job, just building up that area and doing some really creative, cool things out in the community to bring awareness. So greatly appreciated. And I'm sure many more presentations to come from you as you continue to grow that area. Any other questions? Hey, do we have anybody there for public comment at all?
We don't.
Okay. All right. Desi, any closing comments that you would like to make at all?
Yeah, I think thanks everyone I know we kind of mixed everybody up with this virtual today, but it was helpful for a lot of people. So I think that next meeting hasn't been set formally. So once we figure out the new Board of Health, what that's going to look like, we will go ahead and put out the new schedule for that. I think what we're considering is doing like a quarterly schedule for the Board of Health meetings, because typically we have that budget meeting in there that's around April or May. That doesn't really work anymore with the way that we've kind of had to speed up the budget process with the city. And so I think if we consistently went quarterly, and we might also want to consider going to an hour and a half for meetings, since there would be fewer meetings throughout the year, but we could do a little bit longer time frame to get content done. So those will be proposals that would be coming once we get into the new year.
Chelsea, this is Arlette Preston talking. I just want to make sure that you all know I came in quite late, about 12:30, but that I did attend by phone. So just to let the recorder know.
All right. Perfect. Thank you. Okay. Well, I think that's it for then this snowy day, and it for the year. So I've been happy to, like I mentioned, serve in this capacity with you all, and I wish you all a happy holiday and a happy new year, and I'm sure we'll be seeing each other in the public health room. Thanks, everyone.